amigos, me llamo Mariah Gifford. Hoy hablamos su cuerpo!
This is biology.
What? You didn't see that, right? Right? Okay, we're good. First things first, I'm the realist. We're going to talk about the best and worst experiences you've had with your body. I went ziplining in Alaska. I'm in Alaska! And my worst being that I broke my arm twice as a child. Okay, so now we're gonna ask other people about their best and worst body experiences. How about this young lady?
Hi, I'm Jenny.
What's your best experience with your body?
Dancing! It's super fun.
And worst?
Also dancing! It's super painful.
Oh. What's your best body experience?
Well, one time I went surfing. It was so radical.
Let's go surfing now, everybody's learning how. Come on a safari with me. Come on a safari with me. Early in the morning we'll be starting out.
And your worst?
I smashed my thumb in a car door once.
Ow! So I'm talking to this random stranger now. What's the best thing that you've ever done with your body?
Well, I think swinging my old golf clubs in a 50-mile-per-hour wind is the best feeling in the world. Look at this 50-mile-per-hour wind. Makes me feel good about what I do. Later.
And what's the worst thing that you've ever done?
I dislocated both kneecaps.
How, might I ask?
Tripped over a pebble.
A single pebble.
Just one.
One.
Yes. Is this on TV? Hey, Mom. How you doing? I think I dislocated both my kneecaps.
Tonight at 7, your respiratory system and you. Back to you, Jim.
The pharynx is the membrane-lined cavity which is behind the nose and the mouth, connecting them to the esophagus. The larynx is the hollow muscular organ which forms an air passage to the lungs and holds the vocal cords. The alveoli are any of the many tiny air sacs in the lungs where the exchange of oxygen and carbon dioxide takes place. The nasal cavity is a large air-filled space above and behind the nose in the middle of the face. Each cavity is a continuation of one of the two nostrils.
The lungs are spongy air-filled organs that are in the chest cavity. They're protected by the rib cage. The left lung consists of the superior and the inferior lobe. The right lung consists of the superior, middle, and inferior lobes. The pleura is a thin layer of tissue lining the lungs that allow them to expand and contract really easily. They work like a balloon, which takes effort to inflate but has minimal effort to deflate.
The trachea, or the windpipe, is a wide hollow tube that connects the larynx to the bronchi of the lungs. It is an integral part of the body's airway and has a vital function of providing airflow to and from the lungs for respiration.
The bronchi are any passageway for air to the lungs. They become smaller as they get closer to the lung tissues, which are known as bronchioles. They have C-shaped ring cartilage that divides into left and right bronchus. The right main is shorter and wider than the left main bronchus. The right bronchus is divided into 3 lobar bronchi and the left bronchus is divided into 2. The bronchioles are finer subdivisions of bronchi, smaller than 1 millimeter in diameter. They are made of smooth muscle and elastic fiber. Terminal bronchioles passively conduct inspired air from bronchi. Respiratory bronchioles are responsible for the exchange of air plus waste gases between alveolar ducts and terminal bronchioles.
The diaphragm is the primary muscle used in the respiratory system. It is a dome-shaped sheet of muscle
that is inserted into the lower ribs. It separates the abdominal cavity from the thoracic cavity. It is a thin skeletal muscle that can contract voluntarily. Contraction of the diaphragm muscle expands the lungs during inhalation, then the diaphragm relaxes and the air is expelled during exhalation.
Chronic obstructive pulmonary disease, also known as COPD, is an obstructive lung disease characterized by long-term poor airflow. There's shortness of breath, cough with sputum, and it being a chronic disease, it worsens over time. Smoking, air pollution, and genetics are the main causes. Airways become small and the lungs break down. Mainly the elderly are affected. Pneumonia is an inflammatory condition of the lung affecting the alveoli. It is characterized as a cough, chest pain, fever, and trouble breathing. These symptoms can be mild to severe. 7% of the entire population is affected, but this disease is easily treatable as long as it is caught. Pneumonia is primarily caused by infection of virus or bacteria. Other lung diseases may have some cause in it.
Black lung disease is a common name for any lung disease that develops from inhaling coal dust. This name came about because those with the disease have lungs that look black instead of pink. Medically, black lung disease is known as coal workers pneumoconiosis, or CWP. There are two forms, simple CWP and complicated CWP, which also involves progressive massive fibrosis, also known as PMF. Those who inhale too much coal dust over a long period of time increase the risk of developing chronic bronchitis and chronic obstructive pulmonary disease, known as COPD. CWP is caused by the accumulation and inhalation of coal dust in coal miners. This stems from working in a coal mine, coal trimming, mining or milling graphite, and manufacturing carbon electrodes. The severity of CWP depends on the type of coal dust, how much coal dust was in the air at the time, and how long you've been exposed to it. The early stages of CWP have no noticeable effects on the quality of life and no symptoms. However, as CWP progresses and is complicated by PMF, a cough and shortness of breath develop, along with sputum and moderate to severe airway obstruction. Then the quality of life does decrease. CWP affects your lungs by forming a coal macule, which is the combination of coal dust and macrophages. As the disease progresses, macules can develop into a coal nodule, an abnormality of the lung tissue. In a type of emphysema and fibrosis may develop. CWP can be prevented by controlling dust and having good ventilation in the workplace. There is no proven effective treatment for CWP, although complications from it may be treated. Whooping cough, also known as pertussis, is a bacterial infection of the nose and throat. The symptoms are at first similar to that of the average cold and include mild coughing, sneezing, a runny nose, and a fever below 102 degrees. After 7 to 10 days, however, these coughing fits turn into spells that end with a whooping sound as the person attempts to breathe. These fits can last up to 1 minute, and infants under 6 months are especially at risk. They may not make the whooping sound or even cough, but they might gasp for air or try to catch their breath during these spells. If doctors diagnose whooping cough early on, antibiotics can help cut down coughing and other symptoms. They can also help prevent the infection from spreading to others. However, most people are diagnosed too late for this to work. If a person with whooping cough sneezes, laughs, or coughs near you, you have the chance of getting the disease. So, to avoid getting whooping cough, mainly you have to avoid people with whooping cough, as it is a very contagious disease. It lasts 3 to 6 weeks, but is curable if you get the right treatment.
Hey, today we're going to be talking about the common cold. It is a common viral infection of the nose and the throat. In contrast to the flu, common cold can be caused by many different viruses and is usually resolved within 2 weeks. It can be spread by coughs or sneezes, skin-to-skin contact, saliva, or by touching a contaminated surface. Some symptoms include a runny nose, sneezing, and congestion. Hey guys, it's me again. Today we're going to be talking about influenza, also known as the flu. It's very similar to the common cold, but different. It is a common viral infection that can be deadly, especially in high-risk groups. The flu attacks the lungs, the nose, and the throat. Some symptoms include fever, chills, muscle aches, cough, congestion, runny nose, headaches. It spreads through coughs or sneezes, skin-to-skin contact, saliva, or by touching a contaminated surface. So if you want to reduce your risk of getting the cold or the flu, then I would suggest you just get away from people. Have a good night.
Tuberculosis, also known as TB, is an infectious disease that usually attacks the lungs, but it can attack almost any part of the body. Tuberculosis is spread from person to person through the air. When a person with tuberculosis in their lungs or throat coughs, laughs, sneezes, sings, or even talks, the germs that cause tuberculosis may spread through the air. If another person breathes in these germs, there's a chance that they will become infected with tuberculosis. It is important to understand that there is a difference between being infected with tuberculosis and having the TB disease. Someone who's infected with tuberculosis has a tuberculosis gene, germs, or bacteria in their body. The body's immune system is protecting them from the germs so they're not getting sick. This is referred to as latent TB. Someone with the TB disease is sick and can spread the disease to other people. A person with the TB disease needs to see a doctor as soon as possible, and this is often referred to as active TB. Mesothelioma is an aggressive cancer that affects the membrane lining of the lungs and the abdomen. This malignant mesothelioma is the most serious of all the asbestos-related diseases. Exposure to this is a primary cause and risk factor for mesothelioma. So there are three major types of mesothelioma that exist are differentiated by the different organs that are primarily affected. There's a pleural mesothelioma, which affects the lungs protective lining in the chest cavity, which represents about 3/4 of all the mesothelioma incidences. There's a peritoneal mesothelioma, which affects the abdominal cavity, and then the precardial mesothelioma, which affects the cardiac cavity. For the asbestos-related mesothelioma, it is caused by asbestos fibers, which are most often trapped in the lining of the lungs called the pleuria. They can also collect in the lining of the abdominal cavity or the heart. Once the fibers cause biological damage, the stage is set for the decades-long latency period for the development of the malignant mesothelioma. So the survival rates of mesothelioma are often based on the previous large outcomes of the large numbers of people who have had this disease. They cannot predict what will happen in any person's case, but knowing the type and the stage of the cancer is important in estimating the outcome. What should be known is that mesothelioma is a serious disease, and by the time that the symptoms appear, the cancer diagnosis, the disease is often advanced, and regardless of the extent of the cancer, the mesothelioma is very hard to treat, but can be treated with chemotherapy, like several other cancers, but it is overall the symptoms of mesothelioma is a cough, chest pain, and the shortness of breath.
Hi, this is Riley Respiratory here, and these are the #1 tips to keep your respiratory system healthy. Tip number 1, stay away from smoke and people who do smoke, because secondhand smoking is just as dangerous. And today I'm going to save someone's life. You see, during respiration, your lungs are mainly used to inhale oxygen and exhale carbon dioxide, but when you smoke, it makes great complications to your respiration, and your lungs can no longer do the job that they were made to do. So, let's go save someone's life. You see that man way over there? He's smoking, which means he's damaging all his lungs and currently complicating his respiration. So, I'm here to save his life. Let's go. But what you don't understand is that some people can get sick or even lung cancer from secondhand smoke. So, I shall save myself from damaging my own respiratory system. Now I shall tell him to stop smoking. Sir, please stop smoking! Sir, smoking is bad for you! He's not listening, so we must... Sir, stop smoking now! Sir, smoking is bad for you! Sir, stop smoking! You're dead, right? Smoking's not good for you. Tip number 2, cardio. Riley Respiratory here, and here is a good person with good cardio keeping the respiratory system healthy. Look at her go. And here's someone with terrible cardio who is not very good at taking care of the respiratory system. As you can see, she's having trouble breathing. This is what you get for not getting good cardio. Take care of your respiratory system.
And that concludes our segment on the respiratory system. Thank you for watching. Have a good night, everybody.